Dennis. My name is Betty. I'm a student physiotherapist. So I understand that you were referred to physiotherapy to increase the strength and movement in your right knee after surgery. In order to make an effective treatment plan, it is important that I am aware of what medications you are currently taking. Different medications can impact what treatment interventions are available to you or how you will respond to the treatment. Is it okay if we take a few minutes to discuss your medications history?
Sure.
What medications are you on and how much are you taking at the moment?
It's hard to remember the drug names and the exact doses, but I'm on 5 different meds. I think they're Vancro, Glide B, Ediform, Ret, and Lipitor.
Yeah, sometimes when we are taking a few meds at a time, things can get confusing and we can definitely lose track. Can you tell me a bit more about the type of meds you're on?
Well, I've had type 2 diabetes for 15 years now, and started on some medications for that about 10 years ago. The Ediform and Glide drugs are for my diabetes, and I'm told that they control my blood sugar levels. The Ediform I take 4 times a day, whereas the Glide drug I only need to take once. At least I think I do. I put them all in the pill container thing and just open them up when it's time to take them. I also have high blood pressure, so take Rent for that. It's to help bring the blood pressure down. My doctor also told me to watch my cholesterol intake. He said Lipitor helps to liquefy the cholesterol and decrease the amount in my system. The Vancro drug is relatively new. I started on it a few weeks ago because I got an infection from my knee replacement. It went directly into the bloodstream at the hospital, but now I'm taking it only orally for another 5 weeks. I don't know much about the drugs and what they do, but I know that I just have to take them.
That's quite a list. Do you mean metformin and glyburide for your diabetes?
Yes, that's it.
Vancomycin the antibiotic?
Yes, I think so. I can bring all my pill bottles in if you want.
Are you able to bring a current printout of your medication so that we can keep that on your file?
Sure, that would be easier for the both of us.
You mentioned that your doctor told you a bit of what you know about drugs. Did anyone clearly explain to you what these drugs are, their side effects, how drug interacts, and how they help you?
My doctor told me why I should be taking them before he prescribed them. When I go to pick up my medications, the pharmacist always asks me if I know what the drugs are and how to take them. Mostly I just say yes, so I don't want to take too much of their time. But my medications always come with pamphlets, so I do look those over when I first get them.
I'm glad that you are at least reading the pamphlets. However, they can be quite dense and hard to sift through. Just know that your pharmacist or doctor is there to help you if you have any questions. What part of the pamphlet do you look over?
You know, the name of the drug and maybe the first few lines of the side effects. Regardless of what they are, I need to be taking the meds because my doctor prescribed it, so.
Yes, sometimes a list of side effects can be quite lengthy. Just know that sometimes there are a variety of drugs that have the same effect, and what works for one person may not work for another. You can always ask your doctor for more information. With the meds that you are taking, how do you feel like you are managing them? I mean, in terms of taking the right amounts at the right time.
Originally, that was a bit of an issue for me. I kept forgetting to take them when I was supposed to. Then my wife bought me this pill holder thing, and so I always sort them out in there now. Sometimes I get distracted in the evening and forget to take my last dose of the Ediform. One, but not always. Besides that, I do remember to take my drugs.
Do you feel any different when you forget to take your last dose of metformin?
Not that I can tell. I just try and take all 4 doses because my doctor told me to.
Do you feel like the medications are helping you?
I guess the diabetes ones are helping because my blood sugar levels have been pretty normal. I have also been watching my diet and making sure that I'm exercising too. I hope the antibiotic one is helping. After the initial redness and oozy stuff went away, it is hard to tell how much infection is left or if it is getting better. I just know that I have to finish the course of meds, otherwise the bacteria can become resistant. This is the same as herbicides. The blood pressure medication is working because my blood pressure is usually around the same and is normal. I go to my doctor a few times a year and he always checks them then.
What side effects are you experiencing from the drugs?
Sometimes my hand and feet fall asleep. That never really happened before. so maybe that's from the new medication. And sometimes I get some cramping in my legs, that's new too. When I first started the medications for my blood sugar, I used to get abdominal cramps, but that went away after a few months of taking it.
When did you first notice that your hands and feet were falling asleep? Do you mean they feel numb?
Yes, numb, sometimes tingly. It started a couple weeks ago, about when I started the antibiotic, I guess.
How long are they numb for, and what do you do about it?
Maybe 10 minutes or so. I try to move them and it eventually goes away. It's not that bothersome, but I do notice it.
Okay. Can you tell me a bit more about the new leg cramps?
I feel it in my calves at times. I can't really remember at what times I notice it, just kind of here and there. Some days not at all, then others a couple times a day. Just the numbness. Just like the numbness, it's not too bothersome, just annoying.
Okay. We can do an assessment later to see if we can find out a bit more about what is going on with your new symptoms. Depending on how you feel from time to time, do you ever adjust the amount of meds that you are taking?
No, I would never do that. I don't understand much about how to change the dosages, so I just leave that sort of thing up to my doctor.
Besides these medications, do you take anything else? Ones you can buy off the shelves of the drugstore, supplement store?
You count those as medications too?
Yes, a drug is anything that is used to treat or have an effect on our system. Any herbal remedies or natural health products count too.
I used to take Advil quite a bit in the evenings for my knee. After playing golf for a bit, it would increase the pain I was having. I still take it sometimes now, but not too often.
Look at the information regarding how Advil interacts with the other meds that you are taking.
I guess I hadn't really thought about that since I just bought it off the shelves. I don't think it would matter too much.
That's okay. Just a few more questions. Smoking has a large impact on the healing process and how we respond to therapy. Have you or do you smoke?
That's what my doctor told me. I used to have the odd cigar with friends, but my doctor told me that it would interfere with the healing of my knee arthroplasty, so I just decided to stop doing that.
That's great to hear. Did you ever smoke anything else? Any other drugs?
Not since high school. I smoked marijuana a handful of times back then, but that is, I've never done any other drugs and don't do any other drugs.
Many medications also interact with alcohol as well. How often do you drink?
Very rarely, maybe a glass of wine once a month or so, but that's about it.
Have you ever had any allergic reactions or adverse side effects from medications before?
No, not that I can remember.
Sounds good. I think that is all the questions that I have for you. If at any time you start taking any other medications, medicated creams, natural health products, please let me know. Even herbal supplements can interact with medications and can have an effect on how we respond to treatment. Do you have any questions to me before we move on?
I never really thought that my medications would have an impact on my physio treatment. I don't think I have any other questions for today. I will be sure to let you know if anything changes in my medication regime.